You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins us from Sydney in Australia. Dr. Harvey Lander is the Director, Deteriorating Patients, including Sepsis and Medication Safety at the Clinical Excellence Commission in New South Wales. Harvey, welcome to Health Professional Radio.
Hello, thanks for having me.
Now, Harvey, your title's long. Tell us what it is you do.
So I'm a director of the Clinical Excellence Commission, and I work in the areas of deteriorating patients, as you said, which incorporates between the FLAG program and sepsis as well as medication safety.
I see. So sepsis is a program in its own right then?
It is. It's a program that was established as part of the Clinical Excellence Commission to improve patient safety and clinical quality across New South Wales hospitals.
And that's executed, I assume, by hospitals reporting cases. And then what's your work involved?
Okay, well, the Sepsis program, KILLS program itself, is focused on improving how we can identify and treat patients with sepsis. And the way it was established was through the information that we received from incident reports into the Clinical Excellence Commission over a number of years, where we were seeing that we know that sepsis is a potentially deadly bloodstream infection and it needs early identification and treatment, and ideally, particularly in those severe sepsis cases, within the first hour of recognising symptoms. So recognising sepsis and beginning treatment early is essential to good patient outcomes, and that's what we've been doing. I can talk to you a little bit about the number of lives that we're trying to save. We're currently, with New South Wales Public Hospitals, are saving about 150 lives each year by driving down the response times for patients with sepsis. And the program began in 2011. Before we introduced the program, it would take an average of about 3 hours, which was an aggregated median time for antibiotic treatment, to begin on patients that were identified as potentially or having sepsis in our emergency departments. Now we're consistently beginning treatment within 60 minutes, so that's part of the work that we're doing. So as a consequence over the last few years, since introduction in 2011, the risk of a patient dying from sepsis in New South Wales public hospitals has dropped by more than 30%. So if we look at approximately 6,000 patients were hospitalised each year in New South Wales hospitals due to sepsis and diagnosed with sepsis from coding in hospitals, over that period of time, 2 years before the program was established, about 3,053 people died from sepsis in hospitals, or about 1,020 each year. In 2012, the figure dropped to 979, and in 2013, the figure had dropped further to 870.
And Harvey, is that just attributed to that urgent diagnosis and intervention with antibiotics?
We believe, yes. We believe the evidence is that there's been a linear decreasing trend in mortality since in the last 3 or 4 years. And so, for instance, in 2011, from about 19.3%, that mortality rate, to about 14.1% in 2013. We've seen decreasing trends have also been observed in ICU in terms of the number of hours in ICU the patient is spending, and also the length of stay in ICU. So we believe that there's been a number of contributing factors to the decreasing number of deaths, the increasing recognition by health professionals of the need to think about sepsis in any patient who's deteriorating, and also the need to treat them early. And it's on the back of the work that the Clinical Excellence Commission had done between the FLAGs, which is the other program, which really put into place a whole of system response to the deteriorating patient. And that involved a multivalent strategy, and very much the work of the clinicians. And I want to emphasise the clinicians in the hospitals, improvements, and so it's their engagement and their work at the hospital level that has led to some improvements in patient outcomes, deaths, and obviously morbidity as well.
That is a spectacular result from what is not new medical technology or great research, but rather just awareness and diligence, by the sound of the way you describe it.
Yeah, yes, it is. I think one of the important things to say about this is that it's exactly that. It's not necessarily new drugs that will produce, they may well produce great improvements, but it's the actual application of the evidence, which has been come about through research and evaluation, and Australia was at the forefront of of the deteriorating patient work many years ago, and we have published this in Australia. We have a number of very eminent clinicians, and the work we've done publishing a lot of this work in trying to make sure that our system's more reliable. So that if we know the evidence for treating sepsis early and identifying patients early and increasing that awareness, and we actually more consistently apply that knowledge, we know we're going to get better outcomes because we're being more reliable and patients are getting the care that we all wish them to get.
I thank you for taking the time to tell us the story with this, Harvey. It is one of those stories that we don't hear enough of, I think, coming out of the hospital systems, where there's a really good result.
That's true, and also is the ability to take the opportunity to recognise and thank the staff, because they're very hard working, that there is a very strong desire for improvement, and it's also a testament to the increasing capacity in improvement locally, so that more and more of the hospitals and the clinicians are getting to see data and making that into intelligence, so then they can actually review their own local practice. So part of this sepsis work is a strong desire to not just collate information, but to give it back to the hospitals, so that the hospitals can look at what they're doing, compare themselves to where they want to be, and then put in practice improvement methodology to measure that over time and to measure that improvement.
Dr. Harvey Lander from the Clinical Excellence Commission in New South Wales, thank you for your time today. Harvey, if people want to get in touch, I guess the website is the best way to do that.
Absolutely. We have a website which shows the over 20 programs which describing how we can improve healthcare. In addition, people can contact the Clinical Excellence Commission, and we often receive requests and for information or opportunities to partner with other organisations. So we're very much keen to look at how we can collaborate across the system going forward into the future. So thank you very much for allowing me to talk today.
My pleasure. That website, listeners, is www.cec.health.newsouthwales.gov.au. If you've missed my conversation with Dr. Harvey Lander, we have a transcript on our website, and we have an audio archive on YouTube and SoundCloud. Links to all of that information is available on the Health Professional Radio website at www.hvr.fm. This is Wayne Bucklar. You're listening to Health Professional Radio.